I'm Enrico Maraskin. I'm a pediatrician practicing in Morningside in South Africa. This is my passion, little children. I love seeing children in their natural setting, learning, discovering, going to school, playing sport, and staying happy. Here we have the vaccine schedule that is produced by the Pediatric Management Group of South Africa, and we can see from the schedule, very busy slide, and by the time the child gets to 12 years of age, we see that there are lots of injections and lots of holes in this poor child's skin. However, on the left-hand column, we have a long list of illnesses which we're going to consider today. Hepatitis A. Hepatitis A is a viral liver disease, and it's associated with lack of safe drinking water, contaminated food due to poor sanitation. Epidemics commonly set in after a school camp, and globally 1.4 million cases experience hepatitis A per annum. Improved sanitation and vaccination administration are the most effective preventative measures. And in our picture, we have little Johnny doing exactly what little Johnnies do on school camp. They get dirty, they get muddy, they swim in rivers that are unclean, and not only that, but they might collect the water in the bottle that you see in the picture, which is full of contaminants, and if hepatitis A should be one of the bugs that is in that water, hey bingo, now we're in trouble with hepatitis A. Hepatitis B. Hepatitis B is a slightly more sinister illness than hepatitis A, and it's particularly problematic in developing countries. It is transmitted via body fluids, and up to 80% of infected children may not be symptomatic for years, so damage may be happening without this even being detected. The infection leads to liver injury, which can be followed by chronic liver damage, which is called cirrhosis. Ultimately, the infection can result in liver cancer. In our top picture, we have the yellowness of the eyes, which is classic for hepatitis. And in the bottom picture, we have three livers resulting in ongoing hepatitis infection. So the first one on the left is a normal liver. That's what the liver should look like in a normal person. Then the middle picture shows a fatty liver, which is a partially damaged liver. But when the anatomy of the whole liver has been destroyed, you get the cirrhotic liver as depicted in the right-hand liver specimen. I would say that those difficulties with vaccinations that we still have are maybe a small price to pay for the healthy child that we see on the right, with a fully filled out vaccination schedule and smiling, ready to go to school, ready to develop, ready to learn, ready to teach its parents some new tricks. So thank you for joining me, Enrico Maraskin, in this discussion. I hope I've shown you the reason for my passion for controlling the disease processes that we vaccinate against, and I hope it'll give you some insight into making your own decision of whether to vaccinate or not vaccinate.